Well, in 1987, I was born with Treacher-Collins syndrome, which is a genetic birth defect that basically manifested itself at birth. And what this genetic disorder does, it doesn't affect anywhere in the body except for the head. And I have a mild condition, but some have more severe conditions, and some have it to the point that it's not detected by doctors. And with this condition, it's usually meant that the cheekbones are underdeveloped, and so I've required surgery to correct that. I've had several of those when I was going from age 5 to 10. And I was also born without outer ears, and my jaw, my bottom jaw, it didn't really grow as large as it should have to fit my face. And so I had a small bottom jaw, and I needed to have a lot of reconstructive surgery on that, and that caused sleep apnea at night for me. So I've had a long history at SickKids, starting at 3 months old. As a patient, I have to admit that with SickKids, our experience was very, very positive. That's not to say that there weren't negative experiences, um, but those were mostly what my parents had experienced. Myself as a child, I think that what I had experienced was a feeling of helplessness in that when I was really young, there was a lot of stuff that was happening to me, that happening to my body, and feeling that I'm not involved in my care that was something that was very terrifying for me because people were supposedly making decisions for me. But thankfully, my physicians and my parents made sure that as I grew and became older and more mature, that I could have more of a role in my care. But having that sense of helplessness was probably my most negative experience. Well, when I joined, it was back in 2000, so I was very young at the time. And it was basically a team of 10 children and 3 hospital co-facilitators from the child life department. And what had happened was they had kind of put a call out to different hospital staff, asking them to recommend what they felt were exceptional children that could fulfill the role of a children's council member. And when the council was founded, we basically decided to take on a motto of kids helping kids, in that we would gather together, come up with ideas, and try to find ways to improve the patient experience within the hospital, as well as have an advisory role in which we would have different hospital departments and projects and managers come to the council for advice, and we would give it to them. Well, it was 10 children that had been selected through recommendations from hospital staff who felt the children were exceptional and could actually play a role on a children's council. And after being selected by the co-facilitators, of which there were 3, I believe there still are, they would gather these children, ages anywhere between uh, I think our earliest ages were like 8 or 9, up until high school, because children leave the hospital at about 18 years old, and so it makes sense for children's council members to leave at the same time. And so once a month, it was always on a Tuesday that we would meet, and the co-facilitators would always kind of guide the discussion, but we would kind of come up with ideas and whatnot, and they would go out and they would make the connections, they would talk to people, and so that it was something that we felt was important or crucial to the council. They would bring these people and we would formalize these links and communicate, and that was the way we got things done. So even though it was structured in that we had an agenda and everything, and we had a rotating presidency where one child would be the leader of that meeting, it was still structured by the co-facilitators, but the direction was still set by us. Well, perhaps the one that always seems to crop up was that at one of our first meetings, somebody had discussed that they felt that when the operations were to be done, and you're inside the waiting room, there's a point where a physician, where like a nurse or an aide of some kind would take you from your family down the OR hallway to the surgery rooms. And when somebody had brought that up at a meeting, we all agreed that that was a fairly terrifying experience because you're going down that hallway and you're seeing medical equipment. It's a completely sterile environment, and it's kind of cool because all you're wearing is the hospital gown. And we had devised a plan to see if we can improve that experience of walking down the hallway. So we spoke with different departments at the hospital, the OR staff, and decided to come up with painted murals that we can put on the wall and that met the hospital requirements and would kind of make that experience a little less frightening. And I think that that's one of the things that the council really instigated as a change. But that wasn't the only thing. We tackled different challenges such as social networking. Right now there's a process that's going up that's allowing people to social network within a hospital, as well as one of the other things was hospital trays, because they had like a plastic kind of taste to the food when they sat in food, and somebody brought that up. And when we called food services in, and they were incredibly happy to have us taste test different trays, different food that was under different trays. And in that way, we were able to really kind of improve the little things that kids pick up on. Communication was something that I think that the council, that we struggled with, actually. We had suggestion boxes within certain areas of the hospital, and we did get suggestions from different family members and patients. However, we felt that we didn't get as much as we could have, that we didn't get as much attention, as much people knowing about who we were and what we stood for. And we did manage, I think that on my time when I was there, we did manage to get a little bit more communication between different departments and between them and us. But I haven't been there for 5 years, so there's a very good chance that they've done a lot more in the realm of communication. When we had those visitors, usually they were really impressed with the recommendations that we had, and we were often surprised by the fact that there is a receptiveness within the hospital to hear from children. And having a children's council like that it's really a concentrated body that people in the hospital could come to, get recommendations from, get ideas from, and factor that in their decisions. And in the end, those decisions, with our input as a children's council, would then filter down across the hospital and make widespread changes. Well, as I mentioned, my family was always, we're a very tight family. And so from the time that I came to SickKids at 3 months old, my parents took a very proactive role in my care. They always felt that they needed to make sure that they had a second opinion and that they learned as much as they could about the different operations, about my condition before meeting different physicians. And I found it amazing that they were able to do that because this is before the age of the internet when people could just Google it. They had to go and they had to do a lot of research. They had to go to outside organizations. And in the end, I believe that they really made the best decisions for my care. And even though